Helicobacter pylori, or H. pylori eradication. All patients with evidence of active infection with Helicobacter pylori should be offered treatment. The choice of initial antibiotic regimen to treat H. pylori should be guided by the presence of risk factors for macrolide resistance and the presence of a penicillin allergy. Risk factors for macrolide resistance include prior exposure to macrolide therapy for any reason, high local clarithromycin resistance rates greater than or equal to 15% or eradication rates with clarithromycin-based triple therapy less than or equal to 85%. We suggest bismuth quadruple therapy as initial treatment in patients with risk factors for macrolide resistance. Quadruple therapy consists of a proton pump inhibitor, bismuth subsalicylate, and 2 antibiotics, metronidazole and tetracycline, given 4 times daily for 14 days. Alternatively, a commercially available combination capsule containing bismuth subsalicylate, metronidazole, and tetracycline may be used in conjunction with a PPI. In patients with risk factors for macrolide resistance, clarithromycin-based therapy should be avoided. For initial therapy in patients without risk factors for macrolide resistance, we suggest triple therapy with a PPI, amoxicillin, 1 gram twice daily, and clarithromycin, 500 mg twice daily, for 14 days. We suggest substitution of amoxicillin with metronidazole only in penicillin-allergic individuals since metronidazole resistance is common and can reduce the efficacy of treatment. Tests to confirm eradication should be performed in all patients treated for H. pylori. Eradication may be confirmed by a urea breath test, fecal antigen test, or upper endoscopy performed 4 weeks or more after completion of antibiotic therapy. PPI therapy should be withheld for 1 to 2 weeks prior to testing. In patients with persistent H. pylori infection, the choice of antibiotic therapy should be guided by the patient's initial treatment regimen and the presence of relevant antibiotic allergies. For patients failing a course of H. pylori treatment, we suggest an alternate regimen using a different combination of medications. In general, clarithromycin and antibiotics used previously should be avoided if possible. Additional evaluation in patients with 2 antibiotic failures includes culture with antibiotic sensitivity testing should be performed to guide antibiotic treatment in patients who have failed 2 prior treatment regimens. Compliance with medications should also be reinforced. We reserve the use of rifabutin-containing regimens for patients with greater than or equal to 3 prior antibiotic failures.